Welcome again to Decoding Healthcare Research. I'm your host, Ifrey Riveros, Dr. E.F. Rain. Today, we are going to be talking about obesity, exercise, and obstructive sleep apnea. This is a problem that is affecting a significant portion of the population. And to talk about that, we have a very well-renowned researcher from the University of Pernambuco in Brazil. Dr. Ozeas Lins Filho, he's actually a researcher of the Sleep and Heart Laboratory in the University of Pernambuco, and he's also part of the graduate program of health sciences in the same university. Welcome, Dr. Lins Filho, and thank you for being here with us today.
Thank you for inviting me to speak about sleep apnea and physical exercise. It's always a pleasure.
Thank you so much. So we have been doing some reviews about obesity, and we know that obesity has achieved, endemic proportions in the world, and it is associated with multiple disorders. One of them is obstructive sleep apnea, with all the hemodynamic consequences and the effects on the quality of life. So my first question to you is, what sparked your interest in this particular aspect of obesity? I'm talking about obstructive sleep apnea.
Uh, the the part is interested is because the main risk factor for sleep apnea is obesity. Is independently associated to sleep apnea, and the studies over time have found that reduction in weight body could improve sleep apnea, but the methodological difference between among the studies tell us that that is not the main factor by improving the sleep apnea severity. So I'm very interested in indeed study how the association between obesity and sleep apnea occur and how it is affected uh, by the physical exercise.
I see, and it's clear that obesity, as a general term, may be associated with obstructive sleep apnea, but there are definitely regional differences in the distribution of fat, and probably we are going to touch on that as well. And for our audience, I think it's important to know that we are going to be basing our discussion on a paper that Dr. Lins Filho published with his team in the journal Sleep Medicine in 2021. The title of the paper is Effect of Exercise Training on Body Composition in Patients with Obstructive Sleep Apnea, a Systematic Review and Meta-Analysis. We wrote this paper because it has high scientific rigor, and actually Dr. Lins Filho was able to review all the existing literature up to that point, and he put together a very nice meta-analysis, and this is what we are going to be talking about. So what did you find? What was the process of getting to that literature, and how good is the literature out there regarding the association between obesity and obstructive sleep apnea?
The literature is very strong associating obesity with sleep apnea. However, the literature, when we add physical exercise in this association, the results are not so clear. What happens is that we had found some manuscripts, some articles observing reductions in sleep apnea with no reduction in body weight. So this meta-analysis focused on the main aspects of body composition, and we found that the sleep apnea severity reduced, but the body weight did not reduce properly. So it's very interesting finding, because it appears that there are other mechanisms associated with the improvement in sleep apnea with the physical exercise.
Yeah, and this is a very interesting finding. But before we move ahead with the details of the study, because our audience includes people who are not experts in this topic, so why don't you tell us a little bit about obstructive sleep apnea? What is it, and what is the clinical importance of that?
The obesity sleep apnea, the clinical importance is that, for example, the fat around the neck in the people with sleep apnea, it influences a lot of for to affect like a mechanical load around the upper airway. So the deposit of fat around in the neck can negatively impact the sleep apnea by creating a mechanical load and reducing the upper airway. So sleep apnea in obesity people can be described as a not as a deposit in fat in the trunk, for example, but also in importantly in the neck region. So if we can see patients with a neck circumference above 42 centimeters, probably this person has sleep apnea because of the deposit of fat around this region.
Yeah, you are completely right. So that distribution of fat, in specifically in that region of the neck, is affecting the dynamics of the airway, and when the muscle tone is lost when people are sleeping, that is associated with complete obstruction, and the clinical expression of that is actually apnea, and it is actually there are criteria, right, that define obstructive sleep apnea, and that is based on something that is called the apnea hypopnea index, right?
Yes.
Excellent. So that index, basically, the more episodes of apnea you have during the night, the higher the index and the higher the severity of obstructive sleep apnea. That is clear. But let's talk about the process that you guys followed to find the relevant literature and how you narrow it down to a couple of papers. I think the final number of paper was around 15 or 20, if I'm not wrong. How many
Yes.
how many
15
studies? Yeah.
studies. Yes, 15 studies.
15 studies, exactly. So what criteria did you use to pick those studies among all of the other papers that were available?
We included studies with physical exercise, for example, aerobic exercise and strength exercises. Studies with at least 2 weeks of duration, and studies with sleep apnea above 5 events per hour, an AHI of 5 events per hour. And the studies had to have a body composition analysis. This body composition could be from DXA or think fold or BMI. So those were the criteria that we adopted to include in the studies.
So what procedures did you use to start selecting the studies and narrow it down until you ended up with the 15 studies?
We searched in 3 databases, PubMed, Scopus, and the Cochrane clinical trials, and then after that we applied the inclusion and exclusion criteria, and we excluded book, other meta-analysis, other systematic reviews, and we looked at the studies that presented pre to post values for the body composition outcomes, and also the pre to post values for the AHI also.
I see. Now that you were able to select the 15 studies, how do you assess the quality of those particular studies?
We apply the Pedro scale. Pedro scale is a scale used to assess the quality of the studies. This scale assess the randomization, the some bias, the allocation of the patients. So we assess the sleep, the quality of the studies with the Pedro scale, and we found the moderate quality of the studies.
Yeah, and I think the when you put together several studies, one of the concerns is the heterogeneity among them and make them comparable. So how did you deal with that problem?
We had to perform a standardized median analysis for the studies, mainly for the body composition, because we found studies with body composition assessed through DXA and through ThinkFold. So we had to perform an analysis with a standardized median difference to to overcome this the heterogeneity, because this heterogeneity in our study was moderate to high. We found a moderate to high heterogeneity among the outcomes.
Yeah, and it's important to use this statistical treatment to again to make the studies comparable. So let's move on to the results part of the study that shows actually very interesting and intriguing findings. So what did you find after you conducted this meta-analysis?
We found that physical exercise improved the BMI, reduced the BMI, reduced the neck circumference, reduced the body composition, but we found no reductions in body weight.
No reductions in body weight. That's interesting. So so what do you make of that?
Um, the reductions in body weight, I'm not sure if the physical exercise can reduce also properly the body weight, because we didn't control the diet in our meta-analysis. And then I also expected found no reductions in body weight, because we performed another study in our lab, a clinical trial, that we saw improvement in the AHI with no reductions in body weight. So I'm very sure that there are other adjacent mechanisms, so underlying mechanisms associated to improvement of the AHI, the sleep apnea, through the physical exercise. So it was not a surprise for us, this lack of reductions in body weight.
Yeah, and actually the reason why we picked this study to study it in depth was that people tend to think that just losing weight is the explanation for the improvement in obstructive sleep apnea, but your study showed that the improvement occurred even in the absence of the body weight reduction, and that is interesting because that opens the window for new mechanisms, other mechanisms involved in the improvement of obstructive sleep apnea. And once those mechanisms are discovered, probably some therapeutic solutions can come to mind, especially when it comes to research. And that's actually leading to my next question. So now that we know that the weight loss is probably obviously a contributing factor, but not the only one, what do you think is actually helping when you start doing exercise? What do you think could be a potential mechanism to impact the obstructive sleep apnea pathophysiology?
This is a very interesting question. We are right now assessing the effect of strength training in the sleep apnea severity. Uh, I think that the rostral fluid shift can be a mechanism associated with the improvement in sleep apnea severity. So the accumulate the content of the water in the lower body can influence also the sleep apnea, because when people lies, this liquid, this fluid goes to the neck region, so I think that the physical exercise can reduce the accumulation of this fluid during the day, in people with sleep apnea. Another mechanism is the effect of physical exercise on the strength of the respiratory muscles. We are assessing by a monovacuometer the strength of the PE and PI max, the respiratory efforts. So our hypothesis is that the physical exercise can improve the strength of the respiratory muscles, and by improving those, the respiration, the drive of the respiration is in balance, is balanced during the night. So the mechanism of respiratory system can improve with this now balanced system, the balanced strength of the respiratory muscles. So we think that those two mechanisms can be related with the improvement of sleep apnea with through physical exercise.
Yeah, that's true. Those two mechanisms make sense. Actually, when we think about the second mechanism that you mentioned regarding the strength of the respiratory muscles, specifically
Mhm.
the diaphragm, but not only the diaphragm, I can see that relatively firsthand when I put the patients under general anesthesia. What I see is that in the transition, when they lose consciousness but they are still breathing on their own, you see
Mhm.
how the respiratory work increases, but part of that increase in respiratory work comes from the upper airway. So the
Mhm.
collapse of the upper airway due to the loss of muscular tone is definitely something that happens under anesthesia. Obviously, sleeping is not the same as being under anesthesia, but the effect on the respiratory muscles is something that could happen when you go to sleep. And I want to focus now on the first mechanism that you mentioned. So what you are saying is that the venous return of the upper part of the body improves obviously during the day because the patient is in the upright position, I assume, right? So when
Yes.
the patient lays on his or her back, then the hydrostatic gradient is kind of lost, and then there is some engorgement of the venous vessels, and that leads to obstruction. That is the basic idea.
Yes, this is the idea, the perfect idea. So is all is almost like the mechanical load of the obesity, but with fluid, not with with fat. So the idea is the same. It makes a mechanical load around the upper airway, but with fluid, not with the fat. So it's the idea.
And that's interesting because the even when a patient is using the CPAP machine, that increase in pressure is transmitted to the interstitium that could be helping via that mechanism, not only just by physically opening the airway, right? That would be like an accessory mechanism, maybe.
Yes, I think I'm not sure which accessory mechanisms can be related, but I think that there are accessories mechanisms associated to this improvement, to this mechanism, to this reduction in the collapse of the airway. I'm not sure which one.
Yeah, yeah, and I see that that you are doing research in this particular topic, and we really appreciate that you are here sharing your knowledge with us. But what do you think is the next step in order to continue clarifying the pathophysiological mechanisms, and more importantly, how to improve the quality of life of patients with the obstructive sleep apnea based on the research that your team is doing?
The big question is that we have no idea how to configure, how to arrange the best physical exercise program for improvement of sleep apnea. So I have no idea which intensity of the aerobic exercise the best. We have no studies assessing this. We have no idea which type of physical exercise. For example, is strength training better than aerobic exercise? We have no idea because all of the students in the program mix a session with both exercise in the same session. So we can't see the isolated effect of the type of exercise. So we are looking at the configuration of the program, the regimen. For example, trying to understand which intensity of the aerobic exercise is better, which type of physical exercise, aerobic or strength one, how long does the how long must have be the session, 30 minutes, 20 minutes, we have no idea. What about the frequency, 3 days per week, 2 days per week? So in our lab in Brazil, we are focused in the try to understand how the configuration of the physical exercise can improve the sleep apnea severity the most.
And there is definitely a component of customization of that exercise based on the individual characteristics of the patient, because some patients have more like functional limitations than others. So you need to probably tailor the exercise program to each of them. Not all of them can be treated equal, right? Some patients can do more exercise than others, I suppose, right?
For sure. And so some patients can do a higher intensity than others. So it's very important. Also, the time of the day. Which time of the day is the best time to exercise to improve sleep apnea? Morning? Afternoon? We have no idea. I have a master degree student who is studying the effect of the time of the day, the moment of the day in the sleep apnea severity. And another study, another master degree student of our lab is studying the effect of strength training. So we are looking to discover like a personal prescription for the patients with sleep apnea.
Yeah, and that makes sense. Not only for patients with obstructive sleep apnea, I think the prescription of exercise, like with a medication or nutrition, has to basically fit the needs of each particular patient. And I like the topic that you touched on about the chronotype. When is it better to do exercise, and if it's going to be the same for every type of patient? And this probably has to do even with the activation of genes that are regulated by the circadian cycle. That
Mhm.
is that is that is really exciting, and I see that you guys have a lab working on all these areas. Is your lab only dedicated to obstructive sleep apnea, or it extends the effect of exercise beyond that?
Our lab is dedicated to sleep apnea and to the cardiovascular outcomes related to the sleep apnea also. Our focus is in those two topics, the cardiovascular health of these patients and also the sleep apnea severity. We are looking deeply in these two outcomes.
Yeah, thank you so much. And I feel that the paper, because you included a significant amount of articles, and you were able to drill down until you found the ones that actually could provide useful information, is something that is absolutely adding value to our understanding of obstructive sleep apnea and obesity. And in order to wrap up our conversation, I want to ask you, what is the takeaway message based on your findings? Something that can be useful for our audience.
The takeaway message is that people with sleep apnea must realize physical exercise to improve sleep apnea severity, and I think that people can't be aware of the weight. Uh, I think that there are other mechanisms. So by doing physical exercise, for sure the sleep apnea severity will reduce with losing weight or with no losing weight. This is the message. Do exercise.
Yeah, exactly. Doing exercise is critical, and I will insist also on something that is important. Some people, as they gain weight, they may not even realize that they are developing obstructive sleep apnea, And there are clinical criteria for that, and this is not the setting to go over those. But if you or your partner tells you better that you are snoring overnight or you wake up tired, it's different signs. Please go to your doctor and start investigating, because this is something that the earlier we start treating those conditions, the better your quality of life and the least severe the consequences. And I think exercise is definitely at the top of the list of the interventions to improve the quality of life of patients with obstructive sleep apnea. And I think this way we can come to a close. And I want to thank Dr. Lins Filho for sharing his knowledge with us, and to illustrate a little bit regarding the relationship between body weight, obesity, obstructive sleep apnea, and how we can impact that with exercise. So thank you, Dr. Lins Filho, for being here with us.
Thank you for inviting me. It was a pleasure talking about a topic that I love and I study every day.
Thank you. Thank you so much. So for our audience, don't forget that in the description of the video, you will find the link to the paper that we discussed today, and some information about Dr. Lins Filho and his lab. Don't forget also to leave us the feedback regarding this episode, and see you next time.
Thank you so much for tuning into this episode. If you enjoyed it, please don't forget to give us a thumbs up and share it with your friends and family. Make sure to subscribe to our channel and hit that notification bell so you never miss an episode. If you have any questions or thoughts about today's topic, we'd love to hear from you. Feel free to leave your comments down below. For more information and references related to today's discussion, you can find them in the video description below. We appreciate your support and look forward to having you back for our next episode.